get better. It was really quite amazing. And what makes me interested in plasmapheresis is this thing called toxicity, which in
Okay.
medicine, when I was in training, and probably you too, toxicity, other than like an acute poisoning, was considered kind of like voodoo. You
Yeah,
know, I mean,
very fringe.
yes, I mean, doctors didn't believe in it. I mean, doctors really thought that as long as you weren't, having bowel movements filled with blood and mucus, your gut was fine.
Welcome to the Dr. Eleanor Stein podcast. In this show, you will hear expert medical professionals, researchers, and people with lived experience share science-based, low to no cost strategies to help people with complex chronic diseases. Listen in for another dose of education, empowerment, and hope.
Hi, everybody. I'm Dr. Ellie Stein, and welcome to this episode of the Dr. Eleanor Stein podcast. Today, the topic is cutting edge treatments. Now, this is going to include some treatments that many of us won't get the chance to try, but they are being used selectively in people with complex chronic diseases, sometimes with considerable success. Sometimes offering a treatment is a way of learning more about a disease. If the treatment works, it gives us tantalizing hints about what might be going on. And if it doesn't work, we can learn just as much from that. Today, we're going to start the conversation talking about plasmapheresis, a treatment to clean the blood. And we have the opportunity to learn from probably one of the few people who's been using plasmapheresis in his office, Dr. Eric Gordon. Now, I first met Dr. Gordon. I had to look back at the dates, and it's almost 20 years ago. I was privileged to be invited to a think tank of ME luminaries. I think back, it was like drinking from a fire hose. There were so many experts, they had so much knowledge, and I was just absorbing it all. And Dr. Gordon was one of the doctors there, I would say one of the few who could look broadly, who could really integrate all of the other areas of knowledge and translate it into treatment for his very complex patients. And after 45 years in medical practice, Dr. Gordon has more clinical expertise than most. As you hear, as you will hear, he also has a very creative mind, and he's found ways to stack different treatments based on a deep understanding of underlying biology and pathology. So, Eric, welcome to the podcast.
Thank you so much, Ellie. It's a very, very generous introduction. Thank you. That was quite a conference. Yes, it was a real honor. Uh, One of my someone put up a lot of money for 5 of those conferences on different subjects, and
Yeah.
it was a real opportunity to get some great minds together. And what I actually, germane to today, what I learned at that conference
Hmm.
was that none of us really knew what we were doing well. Okay, I mean that sounds odd, but they all knew what they were. The experts who were there, they were really good at what they did, but
Hmm.
everybody was seeing each other's failures.
Oh,
And
interesting.
that was enlightening, because before I went to that conference, I remember sitting there with the patients and thinking, oh my God, if I could only get you to see Dr. Cheney, if I could
Right.
only get you to see Dr. Shoemaker or Dr. Klinghardt, or, it was just always these experts, they'll have the answer for you. And when getting them all together, I realized that um, they had their answers and they did help a lot of patients, but people were different. And I
Yeah.
think that biochemical individuality that was always underpinning my understanding of these complex diseases really got expanded there. And I still doesn't stop me from looking for the next cure. I think I know you do the same. We're always out there looking for
Yeah.
the next thing that's going to be the test that's going to give us all the answers, or the treatment that's going to give us all the answers. And I have, been disappointed regularly, but each time you get answers that help some people. And I think that's what's so
Mhm.
frustrating to this patient population is, if you spend time on on the web, you hear of like, I did this and I'm better. And then you hear 5 others, I did that and it didn't do anything. And that's the
Mm-hmm.
truth. This is an illness of I always like to say, it's your body meets the world. And it's your body. And just as though we are very different in how tall and how short or how much we weigh, but we're even more different in our personalities. And our personalities are more like our immune systems. So
Wow.
anyway, that's the good news and the bad news of chronic illness is that there are answers, but they're not usually across the board.
Right. This is great to start out with the point that we are all so different because I'm the same. I've been, going to conferences for like 35 years, and someone will say, I have the protocol.
Yeah.
And I get all excited and I learn about it and I bring it home and I try it. Back in the day, I'm now retired. And well, it never worked as well as advertised. Never, not a single time. And then I think, well, am I doing it wrong? So, first one doubts oneself. And then I think, no, I think people build protocols based on a small sample size and it doesn't necessarily translate to a more of a general population.
Yeah, and that you said it well. But it's good because if people didn't do that, we wouldn't learn as much because
Right.
each one of those protocols helps some people wonderfully and some people a little bit. And each 10-20% improvement is something we can build on. And I think that's what I always want to. Again, I just wish that one of the treatments we're going to talk about today
Hmm.
is what disturbs me about it is that the price point is really high for a 20% improvement.
Right.
It's,
Right.
and so we love the protocols that are free or minimal cost that will get that same 20% improvement. But
Yeah.
sometimes you do need the high price spread to get where you're going.
I'm just going to back up one step before we kind of dive in
Yeah.
into the deep end with plasmapheresis. For people who don't really know you, can you just provide like a little bit of background? How did you get into this very, your passion for working with these most complicated patients?
Well, I always say it just started because I believed people. When I started doing medicine, I mean, I had always wanted to do what we now call, I guess, functional medicine. When I started, it was alternative medicine, because it intrigued me, because it really looked at people. I cared about nutrition. I thought that was really important. And so I was excited about that. And well, what really sparked me was how different people were, and that concept of biochemical individuality, and being able to do a deep dive on what's going on in the person in front of
Hmm.
you. And I did enough regular medicine for about 12 years, and what I saw there was, if you had pneumonia, we were stellar, but if you recovered from the pneumonia and still felt terrible or felt tired, 6 months later, nobody had anything to do for you. And so that
Right.
just started again, listening, knowing that these people weren't malingering, because that's one of the great problems in medicine. If we don't understand what's going on, our fallback position is the patient is either making it up or depressed, or
Hmm.
somewhere a combination of the two. And I just never bought that because that
Hmm.
wasn't what I was seeing. I mean, I knew the people I was treating. So that's how I got here,
Okay. Yeah. Listening
and
to patients.
listening to patients. And the longer you do it, when you start off, you do get those home runs, because you start seeing people who've just been not quite chronically fatigued, but are just tired, they're overworked, they're doing too much. They're early chronic fatigue, they got a virus and they're not popping back, like I said, a pneumonia, and they're not popping
Hmm.
back. And those folks, if you do fix, look at the hormones, optimize hormones, optimize the gut, which is not as easy as it used to be. Um, and people would get better. It was really quite amazing. And what makes me interested in plasmapheresis is this thing called toxicity, which in
Okay.
medicine, when I was in training, and probably you too, toxicity, other than like an acute poisoning, was considered kind of like voodoo. You
Yeah,
know, I mean,
very fringe.
yes, I mean, doctors didn't believe in it. I mean, doctors really thought that as long as you weren't, having bowel movements filled with blood and mucus, your gut was fine. If you moved your bowels once a week, or you were fine. Um, and so the toxic components were really ignored. I mean, heavy metals was something that, again, the conventional world kind of ignored, but that's where a lot of us started with in the medical
Okay.
toxic world, was dealing with heavy metals. The naturopaths were always way ahead because they understood that the body should be working well, and if it's not, something is disturbing its function. You didn't really just need another drug to suppress a function.
Right.
And I think that's the big learning for those of us who come from a medical background, is that not suppressing, but rather how do we
Enhance. Yeah.
enhance and allow the body to function.
So on that topic of toxicity, there's, like you said, a lot of us got our feet wet in heavy metal issues, and it sounds like you're working now with many other forms of toxicity. What are some of those?
Well, our whole environment, it really is pathetic, but um, you know, things things have changed so much in the last 20 years. I mean, and again, even more in the last 10 years. The number of people who don't respond to straightforward therapies. Okay.
Wow.
A lot of the people who do have chronic illness do have underlying infections. Now, but curing the infections, A, has gotten harder, and B, often isn't sufficient to get people back to health. I mean, that's why I think a lot of the frustration with people who are told they have Lyme disease, they get excited, they take
Right.
antibiotics, or they take herbs, and, they either get sicker or a little better and not really well. And
Hmm.
that's, in my view, is that those infections might have been perhaps big triggers of what's going on, um, or yeah, things, or big weights on their system, but they weren't the whole process. The problem seems to be this um, background level of toxicity, and that comes from, I mean, the simplest thing is the glyphosate exposure. I really
Yeah.
have to say that because we're seeing so much more inflamed gut. Everybody has an inflamed gut. I don't think I don't, and the issue with the inflamed gut is you can have fairly normal bowel function. You don't have to have bad SIBO, a lot of bloating
Hmm.
or a lot of diarrhea or mucus to have a chronically low level inflamed gut. And I think that's, again, we saw that with COVID, is that people who had healthy guts probably had a much easier time with COVID because the bifidus in the gut probably has a lot to do with being able to deal with a viral load. Our,
Yeah.
our gut bacteria, are an organ. They actually, besides just giving us some vitamins and some nutrients, they actually listen to our information. So when we're inflamed, the gut changes, and there's a lot of back and forth there. So getting back to the question of toxicity,
Hmm.
we can just go down the list. I mean, obviously the heavy metals, um, the glyphosate, the plastics, which is now the new buzzword. I mean, but again, that's been in there, and we just didn't know enough to measure it.
Yeah.
I mean, who knew? I mean, nanoplastics, microplastics, not good things. The volatile organic compounds, all the things we're getting from everything that outgasses in our houses, because, how many people can afford wool carpeting?
Right.
I mean, most people, or real wood furniture. I mean, almost everybody is living in a sea of plastics. And
Yeah.
and the chemicals that are used. So it's not just the ones that we ingest, but the ones we inhale. Um, And then we have, of course, the great labor-saving and kitchen-saving device of Teflon. You
Oh
know,
my gosh. Yeah.
everybody loves a pan that you don't have to scrape for an hour. But unfortunately, like many labor-saving devices, it comes with a much bigger cost than we had any idea about. So the perfluorinated compounds are a biggie. And again, going back to plastics, it's the
Yeah.
phthalates and all the softeners, the things that make
Yeah.
plastics
Nice and squishy.
squishy and able to bend into what you want them to do. Those are all things that affect, our hormones and our detox abilities. And so anyway, so that's what's
Okay.
going on from a toxin load level. And we're not even going to the EMFs because I don't know really.
Well,
That's
plasmapheresis probably won't help with that.
I don't think so.
Um, so does plasmapheresis help with those type of toxins? My understanding is it's in conventional medicine, it's more often used for autoimmune diseases because you can kind of cleanse the antibody complexes out of the blood. But it sounds like you're using it maybe for some different purposes.
Yeah, so just a little background on plasmapheresis.
Sure.
So plasmapheresis, yes, in medicine, started in clinical medicine probably a little bit in the 60s, where it was used, for some acute autoimmune diseases, things where there were really excess amounts of antibodies that shouldn't be there. For instance, like Guillain-Barré, severe myasthenia gravis, something
Hmm.
called Waldenstrom's, but you just things where there were a lot of antibodies, and lo and behold, when you remove them, symptoms improved. Now, unfortunately, symptoms don't stay away because your body keeps making those unless you deal with the underlying trigger for that. But still, it can be life-saving in the acute event. And they also started to use a lot of it because they started to do chemotherapy in those days, and they started to need platelets or white blood cells. And it was really hard to harvest that from from donors.
Hmm.
And so plasmapheresis was one of its big initial uses, and that's why when the machines that we're using today were really developed in that era, and especially with the idea of being able to remove blood products from the blood. So basically,
Okay.
plasmapheresis, the way we use it today in America, is mostly a centrifugal device that spins the blood and separates it by density, by how much kind of it weighs. And most of the time, what we're doing is we're taking, for our purposes, we're taking out what's called the plasma, the liquid component that contains the antibodies, albumin, uh, and a bunch of toxins, and we'll get to that. And
Okay.
we put back into your bloodstream the white blood cells, the red blood cells, the platelets, plus we reinfuse clean albumin. And that's
Okay.
the real key component here, this albumin. And albumin is the main protein that your body has in the bloodstream that has enough particles to keep the fluid inside the blood vessels. And it also carries a lot of your hormones, transports drugs, it
Right.
goes around through the system and also picks up toxins because it goes into the tissues and then comes out and goes through the liver and gets cleaned up. And albumin in the body usually lasts about 3 weeks before it's broken down and regenerated. So it's one of the longer lasting proteins to float around. Um, and the more, so going back to plasmapheresis, so plasmapheresis was basically used though as a way to remove these harmful antibodies that would usually be a big deal. And occasionally in acute liver failure, there's some toxins that it can get out better. Mushroom poisoning is one of them.
Hmm.
Um, and the um, the big use in our world, what got me first aware of plasmapheresis was using it for pans and pandas, because this
Okay.
post,
Just explain what that is.
yeah,
Not everyone might know.
I
Yeah.
didn't think so, because
Okay.
pandas was originally described in mostly in kids. It was kind of pediatric, and I forget what the whole acronym stands for, but it was a post-strep infection thing where kids would develop tics, OCD, behaviors, just like all absolutely normal children, normal development, everything looks fine. They're 10, 11, 12, they get a strep throat, and a week later, they're washing their hands incessantly. They won't leave the house. They're having food, weird food preferences, all
Mm.
kinds of, you know, very disturbing behaviors, and sometimes neurologic behaviors, anger,
Mhm.
really can be very difficult to control behaviors that would be extremely disruptive. And it was felt to be a cross-reactivity to the antibodies that your body makes after a strep infection. Now, since then, we've learned that it doesn't have to be just a strep infection. Multiple other infections can do it. High on the list, in our experience, is Bartonella. And be a
Okay.
cause of PANS and PANDAS, because you don't have to be a kid. This can happen with adults as well. And uh, the usual treatment for this that's evolved is IVIG, intravenous immune globulin, which is giving people lots of antibodies from lots of people. Okay, and it works as an immune modulator and lowers this this overly aggressive immune response.
Hmm.
But when people are really acting out, it can be difficult to get enough, because it can take, usually it can take sometimes 2 or 3 months of the IVIG before there's, or even longer, before there's a significant improvement. And the beauty
Okay.
of plasmapheresis is many times 1, 2, or 3 plasmaphereses over just a week, or can just make a tremendous difference in behavior and how people feel in this
Okay.
particular instance. And so that's how it was making noise to me. The other big thing that got me really interested, and actually why I got the machine, because it's a very expensive device, but I got it
Wow.
because I'm not so young, and I worry about my cognitive function. Like you can see a watch that I'll be looking for words, you know,
Yeah.
word finding.
I hear you.
It happens. And so I had been looking at the, what I guess now we call the health optimization literature. And, Dr. Kiproff, Dobie Kiproff, is an immunologist who's been working with plasmapheresis since about 1979 or 80. And he actually has an office not far from me. And he had the idea that removing the wrong proteins out of the body would help Alzheimer's and dementias. And they
Hmm.
did the first studies on this back in, I think, in 2012 or so. But again, they weren't great studies. They weren't well powered enough, but they did show some hints of working. And then as people did work with the, they call parabiosis, where they would hook up, 2 animals, like 2 mice or 2 dogs, and the old mouse and the young mouse, and they would share their bloodstreams. Okay. And the young mouse started to look a little old, but the old mouse started to act young, and also not just act young, but biochemically they were young.
Yeah.
And
Become younger.
they actually did become younger.
Yeah.
It was quite amazing. And so people had this idea that we should be transfusing blood from young people, and that's still out there. But I really believe, and I think the data is pretty clear, that most of the benefit was from removing old proteins. Okay, and they've shown this with animals since then, that it's really
Hmm.
removing the plasma that is giving a lot of this youthful regeneration. So that got me very interested in it. And since then, there's been other studies that are looking positive. Again, it's not the fountain of youth, if you're really, but it does help. It has a lot to do with the removal of what we call senescent cells. And
Ah, okay.
so just to have a 2-minute story about senescent cells, because I think
Hmm.
these apply to not just people who want to, as they say, be health optimizers, but to people who are chronically ill, because it's the same process. In the healing process, when anytime you get injured, you get an infection, you have a toxin exposure that maybe hurts a few cells, well, some cells die and are replaced, but some cells kind of just get injured and then they have to heal. And going through this healing cycle is the difference between going back to normal health or winding up with a little not so good health. And,
Hmm.
maybe they can be from like less suboptimal to like really terrible, is how many cells in your body are stuck in this uncompleted cycle. They didn't quite
Yeah.
finish. So they're not dead. Okay, they're living, they're communicating with your body, but they haven't gone back to normal. So the signals that they're giving are what you would be giving when you're still ill, which are inflammatory signals. And these are done through proteins and through actually exosomes, pieces of the membrane that break off. And these signals persist in us, and that's probably a lot to do with aging. Not the whole story of aging, but it's probably a big piece of aging. Um, and plasmapheresis does remove these senescent signals. So it's not removing the cells, but it's removing the proteins that these cells are doing, which are signaling to the body that we're still not well. And when these signals go away, the senescent cell at that point, um, often will either die or sometimes complete the healing cycle, finish,
Wow.
because its own signals are what's keeping it stuck. And I always compare this to psychology, where our own neurotic behaviors keep
Yeah.
us stuck in that same pattern of how people treat us.
Yeah. Yeah.
We,
So, as you were talking, I was thinking, are you saying that these senescent cells, it's called SASP, right?
that's the name of the
Senescent,
proteins.
yeah,
Senescent associated signaling protein. Maybe I
yeah,
might be
something like
making that up,
that.
but it's SASP is the acronym.
So, are you connecting that with Dr. Navio's research on the healing cycle and incomplete healing? Is that kind of,
Absolutely, yes.
oh, okay.
That's a part of it. In fact, Dr. Navio's studies are coming out, but he's done one of these before with Dr. Prusti in Germany, where they took
Mm,
the um, the plasma, because you get plasma, and when you draw your blood and you spin it, and if you
yeah,
ever notice that little thing that you get the red blood cells on the bottom and the top on that yellowish fluid on the top, that's the plasma. Okay. And when you take plasma from people with chronic fatigue and put it into tissue plates with healthy cells, they will act like the chronic fatigue cells. They'll start
yeah,
to produce the same signals. And um, as though that healthy cell now is acting like a chronic fatigue cell. So it's clear and so those are SASPs.
got it,
Those
got
are
it.
those same signals that happen. It's just part of life. Um, and by removing those signals, we're letting the body or the cells have a
Heal,
chance to hear something new. Okay.
got it.
And if we're lucky, they do. But again, since this is a symphony, and I think that's what's frustrating for people who try to study Dr. Navio's cell danger response with the CDR1, 2, and 3, and everybody asks, well, what do I have to give to get it to go from 1 to 2 to 3 to finish? And unfortunately, it's a symphony. There's no one
Right.
substance that does that. It's the whole milieu of the organ or the body that is the signaling. And that's why he talks a lot about what he calls salutogenesis, which is just doing the normal health signals, such as sunlight, being on the earth, being in the woods, learning
Yeah.
how to breathe, healthy diet. I mean, which sounds frustrating because when you're really ill, and go, I've been there, done that. I'm not better yet, but unfortunately, it's not the sufficient thing to do to get well, but it's really often very necessary to have those health
Yeah,
signals there because we're not sure what button to push. Okay, because
right.
it's a symphony of information, not one note.
And that's such an important message because, like you say, people are waiting for the note, right? They're waiting for the one drug or the one protocol. And I think the older I get and the more I, observe people getting better or not getting better, I realize that self-management is so key. And so self-management is all the bit players that are comprising the symphony,
Exactly.
right? And without it, the best conductor in the world can come in, but he's not going to get the result.
Yeah, and that's exactly I mean, what we see with plasmapheresis for chronic illness.
Okay.
Okay, so that leads right into that. That I think very important topic because there, when I first got the device, the plasmapheresis device, it was like right in the middle of COVID.
Okay.
And long COVID was, people were really beginning to pay attention that people were getting sick and not getting better. And that was what was exciting is that there were some case reports, and this is what always happens in medicine. As we were saying, the answer, the
Yeah.
case report, I did X and they got better. And those are wonderful things because that gets everybody to pay attention. So there were case reports of people with long COVID early on, about a year into COVID, 2 years, and they would do plasmapheresis, and like they would throw down their canes. It was really great. Unfortunately, that in larger studies, there were a few that were had like over 100 patients. I mean, reasonable sized studies. It just didn't seem to work. Um,
Mm.
but it did work in some people. Okay. And I think a lot of that has to do with maybe how long the people had long COVID and their pre-morbid health. Was this just
Mhm.
something that threw them over and they just had to remove a few of the sticks they were carrying before they could stand up straight again? I don't know, bad metaphor, but
Have you tried the plasmapheresis yourself?
oh yes. Oh, um, I haven't done it as many times as I would have liked because in the beginning, when we first started using it, we were using metal catheters. And so that the catheters are what you stick in people's veins to get access. And they
Yeah.
and they have to be, because this machine is sucking your blood out with a significant amount of pressure, it has to be a big catheter. And I do not have the world's greatest veins. And on top of that, I happen to have the kind of veins that actually often hurt, because many people can have needles, have their blood drawn, they don't feel it. But some of us will get almost like an electric shock when the
Wow.
needle's in the vein. I mean, depending what it hits, just
Yeah.
I think it's just how your veins are innervated, what nerves are there. We're all a little wired differently. Thankfully, most people aren't like that, but I'm one of them. So it was never fun getting stuck. But in the last year, two big things happen. One, we have found catheters that are flexible, so we
Mm.
don't need the metal ones that are big enough. And the other thing is using ultrasound. We're using the what's called the basilic and the cephalic. These are two big veins in your arm, places where people would put PICC lines and things into. But
Mhm.
these are not them. They're just regular catheters that come out. Um, but when they're inserted there, we numb it up, and it's been very comfortable, much better. I'm very
Wow.
happy to say. Um,
Can you describe the experience? Like someone comes into the clinic and they sit down, and what happens to them, and how long does it
oh,
take?
yeah. Well, so again, the length of treatment depends on two big components. One, how big you are, and
Mm.
but more importantly, probably is how uh, how fast how your veins are, because the veins actually have people always think of veins as these like tubes, but and arteries are things that constrict, but veins also can tighten up. And surprisingly enough, people can really shut down their venous system and really make the flow very slow.
Wow.
Sometimes we actually use intravenous midazolam, Versed, like Valium, and it's quite amazing to watch the flow change. um, you know,
People are, yeah,
yeah, I mean, again, in medicine, we were taught that the veins were kind of like, they didn't, they got bigger, but they didn't really
right.
constrict much, but they do. And I think
Okay.
it's the same reason why I had pain, is because not being a very brave person, I don't, when they stuck me, I wasn't happy. And going deeper, the vein is bigger, so the surface isn't being touched as much.
Yeah,
So
yeah.
anyway, so the patient comes in. The quickest 2 hours is we never almost never do it in 2 hours, because I think running slower speeds in the machine is more efficient. You remove more of the plasma, and two, people with mast cell tendencies and just our patients in general do better when things don't change fast. Simple as that, you know. So a slower flow is better because these machines, one of them they go between 120 and 140 milliliters a minute. So what's that? That's like what, 4 ounces, 4 to 5 ounces a minute of blood
Wow.
can be sucked out. So that's a lot of blood, okay? Because we're trying to do, you know, about 3,000 to 4,000 milliliters of blood to be filtered in a
And
sitting.
then does it come back through a different
Yes, we need two
catheter?
veins. Yeah, we
Okay,
need two veins.
ouch.
It's sucked out
Yeah.
from one and put in through the other. Okay. Um, and so again, the procedure can, you know, usually I'd say 3 to 4 hours is a much more reasonable time to be sitting there. But really, with the flexible catheters, it's comfortable. And if you use the upper arm, you can move your hands, which is kind of nice.
Mhm.
So you can scratch your nose if
So
you.
the blood kind of goes out of your body into the machine. The I don't know, we'll say the particles, the toxins, the molecules in the blood are
Well, basically,
removed.
it goes into a centrifuge device, so it
Oh,
gets spun
okay.
slowly, but it's spun in a way that the densities, you know, if you ever
Yeah,
the heavier particles, you know, will accumulate towards the outside. I believe. Might have that backwards.
I think that
I
makes
think so.
sense. Yeah.
Yes. My physics is failing me. And they're siphoned off, and the red blood cells, the platelets, and the white blood cells, plus albumin
Yeah.
is flows back in. It goes through a tube, which goes through tubes that go around the little blood warmer, because we want to get the blood
Mm,
back up to body temperature. Because
yeah.
it's just nice. You don't have to, but it's much nicer. Your veins and your body is much happier when the blood comes back at the temperature it left. And yeah, we don't want to stress you more than we have to. But um, so, you know, it's one of those things that you'd rather not, you'd probably rather be doing something else. But other than the needle stick, once they're in, it's relatively comfortable. You can sit or lie, and, you know, listen to something in your iPad,
Yeah.
watch a video, whatever you would like to do to entertain yourself. And the nurse is there with you the whole time because they're watching the machine. The machine is it's computerized. So it's very sensitive to the blood flow. It always trying to match what it's
Yeah.
sucking out to what it's putting in. And so if for some reason your veins tighten up, and the machine makes noise, and then we have to do things to get the blood flow to be better. So the nurse is there right with you, very attentive.
Okay.
Um, and you know, we also put back in some minerals, especially calcium, because we don't use heparin generally with this machine. You can when if somebody has an issue, but most of the time we use citrated dextrose, which binds calcium to prevent the blood from clotting
Oh, I see.
going through the machine. And so the calcium gets bound, so we have to put back in some calcium. Otherwise, you can get a little bit of the tetany feeling, a little tightness
Yeah.
around your
Yeah.
mouth, and just basically, So we make sure that we put back what you need so you stay comfortable. Another thing to know for the process is this is one of those things we'd like you to eat before you come, because you will also you can get a little hypoglycemic if you haven't eaten.
Mm,
If you've eaten, you'll be
right.
fine. But if you haven't eaten, uh, it will do that. And it's so here you are, you know, basically 3 to 4 hours. Now, we do a bunch of other things. So that's the plasmapheresis
Right.
itself. We often we preload people with a little bit of fluid, just again to get the blood vessels feeling like, oh, let's open up
Hmm.
here and relax. Um, and we often, depending on what we're doing it for, if we're treating someone who has underlying tick-borne disease, okay, we will post-treatment, after the second, if we do, here's a very important piece. Plasmapheresis traditionally, when it's done in a hospital setting, is usually do 3 to 7. Most of the time, five
Okay.
to seven, because when you're removing the antibodies, that first time you're taking all the we get almost all the IgG antibody comes out in the bag, but half of your IgG is in your tissues.
Oh,
So
right.
we took out half, but by the next day, you've got about a quarter of it floating around in your bloodstream again. So if the need is to remove antibodies, you have to do this every 2 to 4 days, like three to at least probably 5 times to get it to work.
Wow.
You know, um, yeah, I mean, in emergency situations, they will do this daily. We don't do that because you do fibrinogen and some other clotting factors come out, and
Mm.
they come back very quickly. So by the next day, they're getting back there. But it's nice to let the body
Yeah.
get all back because we're not in a rush. Um, Now that's for the autoimmune diseases. And I said pans and pandas, again, you need like a minimum of three. And if you do three and start people with the intravenous immune globulin, you can get away with it. But 5 to 7 will give you a longer lasting effect.
And how would a person know, say they've had their 5 to 7 treatments, how quickly would they be able to say, oh, I'm really feeling better?
Well, the thing I want to mention here is that
Okay.
how we have changed it for the chronic illness crowd. Okay,
Yes.
because we stopped. Yeah, I mean, again, we quickly realized that we weren't getting the effects. Again, the pans and pandas, yay, people, we would really see big changes. Occasionally, there'd be people with chronic fatigue, or like some of the neurologic things from Lyme. We would see improvements, but they were few. Most of the people didn't. We weren't getting big results. Okay, and I said it's too expensive to do unless you're getting a home run.
Okay.
But so we started to look at really what is happening here. What this machine is doing, because just an aside, there's another device. Hopefully, I don't want to confuse people. But we're gonna try. Okay, there's a device in Europe called inospheresis. Okay, ionospheresis starts off a little bit like the same setup as plasmapheresis, except they take a bunch of the plasma out, but they put that back into you. They don't filter the plasma.
Mm.
They filter the rest of the blood, and they're looking to remove again some autoantibodies, um, but especially toxins. Okay, so
Mm.
it's a double filtration method where, like, they they centrifuge, but they filter the plasma they've taken off. I misspoke that they filter the plasma they've taken off, but they put that back in. Okay, after they filter it.
Mm.
Okay.
Okay.
And that's what really got me down this trail, because we sent a few patients to Europe after we figured we treated what we thought we could treat, but they were left with some symptoms that were kind of that were often neurologic, that just didn't make that we couldn't help. They had high antibody levels still, some of them for neurologic things that we'd see in pans and pandas, but they clearly didn't have pans and pandas, but they just weren't better, But and when they had the ionospheresis done, it really like turned the page for them. They felt much better. And they realized they were like 70%, but they were 70% unstable. And when they had the
Yeah.
ionospheresis, they went to like 90, some of them even 100. They were well, and stable. It's that got me interested in the filtering aspect of this. And then Dr. Kiproff and his fellow Dr. Paul Savage, who is setting up plasmapheresis clinics all over America, by the way. There'll be one in
Wow.
your neighborhood soon. And they're using it, again, mostly at the cognitive decline crowd, or
Oh, interesting.
yeah. Um, but what they have done is they started measuring the toxins that come out, because we initially thought that it was the filter, the ionospheresis filter, that was taking out the toxins. We didn't realize that so much of the toxins were actually attached to the albumin. and they were going out.
Oh,
And even heavy metals, that was one thing that surprised me. And I thought I was just ignorant, but I was speaking to Dr. Paul Anderson, who, if you know Paul, is I think Paul's a naturopath who has trained most of the naturopaths and many of the doctors in chelation and IV therapies over the last 30 years. He's and also was a pharmacist. He really understands
hmm.
pharmacology and biochemistry of things, and he was shocked because he was doing some of these studies for them at the amount of heavy metals that was coming out. Basically, lead and mercury, because we think of those as tissue
Right.
toxins. They're stuck in the tissues. We didn't realize how much is still being mixed about in the body, attached to the plasma. Okay, tightly attached to the albumin,
Albumin.
albumin
Yeah.
tightly. So many times we're not even seeing it when we just measure what's in your blood, because of the nature of the testing. So, um, so this really got me excited and thinking, and following some of the research that I said that Dr. Kiproff has done and Dr. Savage have done. I realized, wait a minute, this makes more sense to use as part of a detox and reset, because we're doing two things. We're also resetting the immune system. And it's not just the antibodies. When we remove that many antibodies, you're changing how your T cells are working as well. Because remember, it's a symphony. B
Yeah.
cells, which make antibodies, work in concert with T cells. And we always think the T cells tell the B cells what to do, but not quite like that. The B cells also
Mm.
feedback and tell the T cells what to do. And when there's a lot of these antibodies in the bloodstream, your T cells are getting an inflammatory signal as well. And so they stay stuck in this, like, let's make a lot of interferon gamma, IL-6, all these chemicals that we know cause inflammation. So using plasmapheresis as a maybe once a month for 2 or 3 months, or sometimes in some people, and this is what we're still trying to work out, is the timing for what's going to
Mhm.
be best for the patient, because we know that the heavy metals kind of, like day 3 and 4 after plasmapheresis, they'll start to go up again as your body's
They're coming out of the tissues.
yeah, because your body rebalances. It wants to keep a certain, basic chemistry. If you've got, 8 molecules of something in one
Mhm.
compartment,
Yeah.
4 in the other, your body wants to keep that ratio. It's just chemistry. I'll leave it at
So
that.
you're using it not kind of acutely like in pans and pandas, but you're using it more of maintenance.
We're using it in a key step, because we do pans and pandas.
Okay.
It's like, Dr. Harris and his crew who has joined us, they did a lot more pans and pandas. I've always been kind of allergic to people under 12. No, I love them dearly. It's just that I've always kind of concentrated on older people.
Yeah.
But so we do the plasma research pans and pandas, but as I'm using it in the office now, is as a step in detox, depending on what people need. Obviously, if we can
Okay.
detox you with, just like as you go, with diet, saunas, binders, and oral things like oral pectosol as binders, or oral phosphatidylcholine, that's great.
Mhm.
But if then we go the next level up, is the intravenous phosphatidylcholine, and something called phenylbutyrate, which again helps get your cells to spit out what they don't need, and again go back to a healthier uh, type of cell. Um, but as we use these things, if we're seeing that, well, we now send some of these for measurement. We're using a lot. We use some of the toxicology labs in America, but if people can afford it, I send it to the INIS lab, or it's now called the AS lab in Zurich, for get a real look at how much of these other toxins are in the system. Because what's amazing is how much DDE, and DDE is a derivative of DDT. Okay, remember DDT?
Right.
Well, and this was outlawed, what, like 45 years ago or something. Okay, and in 20-year-olds, we're still finding a lot of it. Okay, so
Wow.
it's just in the fat, it just keeps recycling, the gift that keeps giving. So, So, again, we look at the patient. If the patient is doing well, they don't need plasmapheresis. But
Right.
if they're if we're if either we're not moving fast enough, or they're not tolerating anything,
Hmm.
even after we replace the minerals as best we can and like tune this, but they still just can't seem to even tolerate low doses of phosphatidylcholine and things like that, then sometimes ionospheresis will remove enough stuff plus putting in the albumin,
Hmm.
which will allow their bodies to tolerate stuff, to tolerate the detox. Because this is again, this is not science. I always like to tell people there's stuff we know and there's stuff we're making up. Okay.
Yeah.
Just like to be clear about that because I hear too much on the internet where people spout things like it's God, no, we don't know. But albumin is a sponge. Okay, that's for sure. Albumin does circulate through the body, picking up lots of important, I said, your hormones and this and that, but it also is a sponge for toxins. Okay, and it goes into the tissues and picks them up. And when everything is working well, it goes to the liver, and your liver metabolizes that, and it gets stuck, down the bile ducts and down into your intestines, and all is good. You get rid of it. But when you've been sick for a while and you have a gut that's kind of overworking your liver all the time, your liver is often not doing so hot. And you can tell because those are the people who, you know, eh, what they put into their body has a one-to-one relationship to how they feel, within minutes to hours.
Right.
you
Super
know,
sensitive. Yeah.
yeah, and you're super sensitive. I mean, it can be because your mast cells are crazy, but usually your mast cells are crazy because your liver is overloaded as well. And
Okay.
so by replacing with fresh albumin, it kind of gives the liver a little breath of fresh air as well because it can unload toxins because it does this. It's a two-way street, this communication between albumin and the liver. Um, and so it just lets the body take a breath, and we can sometimes make progress. Whether we should repeat that in a week or whether we should wait a month, I said the jury's out, and I don't know if we'll ever get a clean answer. I think it's done by the size of your bank account at this point. 'Cause,
And
yeah.
I don't know if you have maybe a story of someone who did well with it.
Oh yeah. I just have a young lady who just here recently, um, who was one of those people who was perfectly functional, athlete, cheerleader, da 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 da, going to college, um, actually postgraduate thing she was going in, and she had COVID, and then found that she was driving and like didn't know, like the road didn't look like it should look, and she was just nothing
Yeah.
was working right. Um, just fell apart basically, and was like that for the last 4 years, and went to see lots of good people. And she's a perfect example of excellent therapies. I mean, excellent treatments, but just done in the wrong order. Okay.
Okay.
Because I'm really big on neurologic chiropractic. I think it's really helpful. But when the body is super inflamed, it generally isn't going to hold, and it doesn't work.
Okay.
She had lots of herbal therapies for her because she also had Lyme and Bartonella and Babesia, which fits the picture healthy until she had COVID, and suddenly she's got all these bugs. Well, she had all those bugs, it's just that her body was keeping them in check, and she
Yeah.
was able to function just fine. And then this was the COVID was the straw that broke the camel's back, and that's how it is. Because I think so many people with long COVID, I'm sort of going off the topic, but just to tell you,
Yeah.
so many people with long COVID, they have underlying tick-borne disease that was just quiet until COVID changed their immune system, and their immune system no longer could maintain its control of these bugs that just live with us.
Can I just go down that rabbit hole and ask you a question
Sure.
about what you just said, and then we'll try to veer
I'll
back.
get back to the patient.
So does that mean that if you have, because I agree with you, like just from my own personal experience, I got sick, I tested positive for Lyme, I did a whole bunch of treatments, they didn't make any difference. Sometime later, I got better. I later tested for Lyme and it's still all there.
Yeah.
And so that kind of put the thought into my head. just because you have a positive test doesn't mean you should go chasing after it.
That's the unfortunate truth. Now,
Okay.
I do treat a lot of Lyme,
Yeah.
and I think it should be treated. The question is, does it have to be treated, and at what time? And because
Hmm.
there are, I mean, this is the issue. There are lots of people that we see that we treat the Lyme, and they do get better. I mean, that's
Yeah.
what started me on all this. It was like, whoo, boy, that's amazing. You know, I didn't believe it. I also thought Lyme was overdone until you see the people who get better, but there's so many who don't. I have a positive fish, which is pretty good indication that the bug is still there for Bartonella. I had acute Bartonella 15 years ago. I treated it, became asymptomatic, but it's still there. Now, would it be
Hmm.
better for my body to not have it? Probably, because we know that there is a cost to your immune system of, like, even think about EBV and MS. It's the same,
Right.
you know, we all have EBV. Some people, it seems to be increase the likelihood of MS, probably because it's keeping, if you, depending on your genetics, if keeping that EBV in control means you're producing a little bit more inflammatory molecules,
Right.
and you happen to have a brain that's sensitive to those, not good for you. It would be better if we had eliminated the EBV. Now, again,
Yeah.
EBV is so ubiquitous, it's probably not a good idea. But when it comes to Lyme and Bartonella, I do think it's probably a good idea, but I would not like to use antibiotics to do that in people who are otherwise well, because
Yeah.
the trade-off, again, you don't know. Lots of people we do that to, they're fine. Other people, their guts never recover. And you don't
Right.
know before who that's going to be, or at least I have some idea, I shouldn't say, but I have nothing that I would want to bet the farm on. So
Right.
to your answer, it sometimes, but yeah, if people have a strong genetic component for dementias, I would be more inclined to maybe get rid of bugs that aren't making noise. If you don't,
Right.
I would be less inclined. And look at your cytokines. I mean, this is what's interesting coming forward is as we're getting more and more tools, because I think cytokine testing, we're getting better. I mean, it's always, I think finding better labs to get more reproducible numbers is helpful. And if they're really elevated all the time, maybe those infections are causing too much of a cost to your immune system to keep quiet.
Yeah.
Anyway, so let me wrap up quick
Yeah. To get
with
back
my
to this
patient.
case.
So anyway, so
Yeah.
this young lady, she was a mess. I mean, lovely human. I mean, she was blessed with a family. I mean, just thank God, because with her, because she had this, a lot of this depersonalization, derealization, like she didn't know where she was. The and OCD about, am I going to die? So the kind of things very
Wow.
pleasant, but who make you crazy living with, you know, every 2 minutes, am I going to die? If this doesn't look right, is it safe? You know, loving family, thank God. So when I had tried to treat her from afar for a long time, too long, and we were just, you know, like pickup sticks, move a little here,
Yeah.
move a little there, move a little there. And so finally we just brought her in, and you know, we did plasmapheresis, and a few other things along with it. But the plasmapheresis was what just, it took the weight off of her. We then followed it with some exosomes, and it was like, you know, for for a month, she was better than, she was almost back to normal. The problem is that she did way too much, which people do.
Right.
Yeah, and she crashed again, which will happen. Um, but it really was a great example. I mean, again, it wasn't like that was, to be fair, it wasn't the only thing we did, but all the other things I've done with her, I've done with lots of people, and I hadn't seen this like black and white response in someone who had been sick for so long. And but
Right.
she's young, so that's the other thing that goes along, is that young people. I mean, she's not that young, 25, but still in that up until 30, the healing abilities of the body are just remarkable. You know, I mean, like, and we always have to be, you know, and I sometimes, when I'm feeling helpless, or not helpless, but feeling like, oh my God, we're not helping enough people, I just talk to some of the pediatricians who are doing similar work, and they get such dramatic turnarounds. Like, oh,
Yeah. Yeah.
it works. Anyway, so again, my main point for plasmapheresis is that I think it's going to be a big help for a lot of people. Um, what's got to change is, is the price point is way too high, and it's just the machinery, the renewables, the nursing time. It's all very
Yeah.
expensive. That may, I mean, and that coming down, I would like to say that it would, but this is America. The chances are small. Um, you know,
Yeah.
but
And mhm.
no,
I
I
was
just
just gonna say, oh,
no,
go
I
ahead.
just want to finish the saying, but the good thing is what you're saying is where as we learn, we might begin to learn um, over time, which toxins are more important and which patients and when. I mean, that's what
Mhm.
it's a little bit of the, it's the Wild West now. We're just starting to do this. Um, and we're going to learn a lot. I think the number of clinics out there that are doing this, and it's the people who are picking this up seem to be committed to actually measuring stuff, which is
Mm.
really good. I mean, yes, they're out there to make a buck, but they're also doing the due diligence on measuring what's coming out on enough people so we can begin to really learn and maybe actually figure out who's going to be the best for going.
So I think that's my kind of wrap-up question is, from your experience with it so far, where do you see plasmapheresis in, if we just took cost away, and I know you can't because it's
Yeah.
a very, sounds like pretty prohibitive.
Yeah, yeah. Well, it's basically, I mean, I think prices run from like, for one procedure without the IVIG that we often use, probably, I think 5,000 to $6,400 a piece.
Wow.
So
Wow.
yeah, this is at this point, you know, uh, this is for the people with lots of disposable income, and which is the problem of everything we're doing still. But the hopeful thing is we're going to learn something that's going to make a difference for everybody.
And what do you think you've learned so far? Sounds like you maybe that toxins are a player in this.
That's as I say, Dr. Parpia, when she joined us about
Mm.
8 years ago, that was her point. And to be fair, when I started working with Dr. Anderson 24 years ago, that was our goal. We both looked at each other because he was a naturopath and I was an MD who kind of wanted to be a naturopath. And we both detox. We got to do detox. The truth
Yeah.
of it was more talking about than doing. We did some, we always saw it but we didn't really make it a cornerstone of what we did. Dr. Parpia, from her experience with working, she took what she learned from Dr. Klinghardt and Dr. Isaac Elias and built her own way of looking at and really made detox what she did for these people with chronic infections. And we saw, that's what got me. We saw
Mm.
over time, that first year, I thought, you're just wasting people's money on all these IVs and all this stuff. I mean, in the office, there was little grumblings, like, the nurses, they're doing so many of these, phosphatidylcholine. I mean, we did these, but she was doing so many. But people were getting better by the end of a year, sometimes 2 years, but they got better without using the antibiotics.
Right.
Okay. And that's what slowly began to make me a believer because, and now as the longer I've been doing this, working with her and seeing how important the toxins are, and that's where I found this place. But it's when the immune system is really on a trigger hair, um,
Yeah.
is where I think this is helpful because even though I'm not saying it's never going to upset somebody's mast cells or never going to upset somebody who's super sensitive. We can, the way we do it, if we listen and we watch the patient and keep it going slow enough, we haven't had any problems yet, with those
Oh,
people.
that's
And that is what gives us the way in. That's sort of like what I work with this young lady, is that everything would blow her up and
yeah.
we could do things. And so again, it's so I'm looking at it, and in some people it's a way to do the finishing, but I think in a lot of people, it's a way to do the middle ground because I don't think people would start there. You know,
Yeah.
I think there's a lot of other things to do, but if you're in that place where nothing is working, and just understand, but it still doesn't stand alone. I don't know if I think it's not the main dish. Okay,
Right.
it's just not. I wish it was. When I got it, I was hoping it was going to be, but at least in our hands, I think we'll see. But looking over the literature, which I've been doing a lot lately. Because there was a lot done in Europe with these different machines. There's only the group who do the inospheresis, and again, it's just their group and their data looks wonderful, but everybody else's looks kind of eh. And as you said at the
Yeah.
beginning, the people who design the things often get better results than the rest of us. So, so that's my sum up is
Okay.
interesting and helpful. And I'm excited that in the next year, we're going to really be able to figure out the timing on when's best for whom.
And I guess my take home listening to you um, is that there's so many layers to this. So, say you're working on Lyme and associated diseases or energy, you're trying to boost the mitochondria, whatever. But if we all have toxic sludge in our blood because we live in just a horribly toxic world, I mean, it really could explain why some of the other treatments just don't get the results that we would expect.
Yeah, absolutely. Because
Yeah,
yeah, you're using a lot of energy. You're using your nutrients just to keep your cells from getting severely poisoned in a way. And
yeah,
and one other I should just sum up is that the other thing plasmapheresis does, which why it sometimes buys us time, is it removes a lot of these cytokines, so it will quiet
oh,
things
okay,
down again. But it doesn't. But this is just transitory. So that's my point. You have to have a plan for what to do the day after.
got it.
Yeah.
Why don't we leave it there? This has been really fascinating. Like I said at the beginning, a topic about I don't even know if it's available in Canada, so it's
Yeah,
something I just don't have.
probably
It's
not
probably
yet.
available for myasthenia
Oh,
and
yeah, no, totally.
yeah,
It's in major hospitals. I mean,
yeah.
it's a part of
But
medicine.
for off-label,
Yeah,
it's
but for off-label uses, no. And pans and pandas, occasionally you can get referrals from neurologists and get it done and get it approved, which is wonderful.
yeah,
If you can do that in hospital settings where insurance will cover it, and that's what we still work hard at doing that for people when we can, is get them
yeah.
covered. But for anything we're doing it for, unfortunately not.
So, Eric, I know that you have one of the things you've been offering of late is these online fora where you get together experts in, different topic areas, and you've got one coming up on,
October 16th to the 18th,
yeah, and
Thursday,
what's
Saturday,
the topic?
is
It's on cutting
peptide,
edge treatments.
yeah, peptides and cutting edge treatments. And you will hear one of the talks will be most of the talks are me interviewing interesting people.
Yeah,
One of them is going to be me giving a repeat of this talk on plasmapheresis, but the rest we have a really interesting bunch of folks talking again stem cells, just understanding
mm,
again not first line therapy for anything,
yeah,
but just about them, exosomes, a bunch on peptides and bioregulators, um, some interesting talks about light, um, and well, I keep feeling like, but there's just a lot of like what's new and
yeah,
what's out there, and that's what we keep wanting to let people know what it is, and hopefully we get feedback and we find out what works because, like you said,
yeah.
we've all been
How
at.
can people find you online and maybe register for this forum if they're interested?
I think there should be a landing, I know on gordonmedical.com, there
Okay.
should be a landing page for the forum, but there also probably is a web page for this just under that name, just the Gordon Medical Forum. We have
Okay,
to go
there you
landing
go.
page because basically this is the third one this year. There's going to be one more of these on nervous system and structure going to
Mm,
air in December. And we'll probably do at least 2 of them next year again on just, it's a chance to listen to 3 days of new ideas. I mean,
Yeah.
and a chance for me, basically, I do this for 2 reasons. One, to share new ideas, but also I get to learn things.
Yeah.
Nothing like talking to people who it's their passion to really learn a lot about what's out there and what's possible.
Thank you so much. This has been really enlightening for me. Hopefully, it will be to my listeners, even though most of them won't be going for plasmapheresis. But it's really intriguing that it just gives us a window into an additional treatment and, just the importance of toxins and kind of like I think you've used the word resetting the system.
Yeah, and so much of the information that you give all the time about how to just take care of yourself is a big, big part of resetting the system and
Yeah.
helping your body get rid of toxins better. So, a
So,
pleasure. Thank you so much for having me.
oh, thank you so much for doing this.
Thanks for joining me on the Dr. Eleanor Stein podcast. I hope you are taking away new strategies and ideas to improve your health and a renewed sense of hope. Join me, Dr. Eleanor Stein, for our next episode. Can't wait? Check out my website for a wealth of free resources.